Hi, this is Sarah of Sarah Q Geist, DBT Myofascial Release. Today we are going to do a self-release treatment for the psoas muscle. So the psoas is a very deep muscle. It's actually a combination of two muscles called the iliopsoas, but commonly referred to as the psoas. And it comes down through the abdomen, crosses over the front of the hip joint, and attaches into the femur. It attaches to each and every of our lumbar, the front of our lumbar vertebrae, and the bottom two or so thoracic vertebrae. So it's very, very deep within the body. A lot of times it's referred to as kind of the front of the back. So if we think about this kind of being our back, it's at the depth just about right into there. So not an easy thing to get into. We have a lot of for a lot of us, some soft tissue, definitely some internal organs, our intestines that are kind of in front of that. And so it does, in order to get into the psoas, it does require going through those areas as well. So there's a handful of different ways to come into and work with the psoas muscle. It's a very important muscle for us to be able to release, because of the fact that it attaches to all of those vertebrae, and because it crosses the hip joint. When we're in a sitting position for most of our day, that muscle's actually in a shortened position, and then when we come up into a standing position, we're requiring it to be able to stretch and lengthen. If it's tight though, it will actually pull those vertebrae forward and give us some of that sway back. I don't know if you can see that with the sunshine beaming through, give us some of that sway back position. So, like I said, very helpful, very important to release. There's also some people that will talk about this being a really important muscle when we're going and experiencing kind of a fight or flight response, that there will be kind of a impulse for this muscle to expend energy and to kind of move and contract and go through its range of motion as we're moving towards something to fight it, or as we're moving away from something to kind of run. And when we go through that experience of a fight or flight response, but we don't have that motion that ideally should come along with it, we kind of clamp it down, that can lead to hardening of these iliopsoas muscles or psoas muscles. So really important when you're working with this muscle, that again, you're really finding that barrier. I've talked about this a lot, this concept of coming up to as much as your body is able to relax around, as much pressure as your body is able to relax around, but not so much pressure that your body is kind of responding and reacting. Very, very important with this muscle that that's the case, because it's such a deep muscle, and it's because it's in an area where really we're very protective of, right? All of these internal organs here, if we have any damage there, internal bleeding, all kinds of stuff can happen. So I'm not saying that doing a psoas release is going to cause that, but what I am saying is that our kind of more animalistic mind is very protective of this area with good reason. So if you are saying to yourself in your head, oh, I can take a lot of pressure, I'm really good with pain, no worries, but you're not actually paying attention to whether your body can relax or not, you're not going to get a good release here. So very important to kind of find some of the gradual ways to come into this. So I'm going to give you a few different ways to do it, so that you can really kind of vary how much pressure you're putting into these muscles. But let's talk first about where exactly that pressure should be going. So you want to make sure that you're off midline. Okay, I always say to people, kind of find the edge of your waist and the midline of your abdomen, and then you're going about halfway in between that. Okay, and so you have one on either side, so you're kind of working right into those zones. And you always want to be below the lowest rib and above that groin, that hip crease or groin. So basically anywhere along into there on either side, okay? And again, different techniques. So one technique is actually using, I'm going to go for the weirdest one first, because why not? Some kind of device like you know, anything that you find that is long and slender. So this is just a wooden spoon from my kitchen. And you want to do this in sitting, which allows that psoas muscle to kind of be in a shortened position. And you're going to take that, whatever it is, end of a wooden spoon, and you're going to put it anywhere along in there. You can kind of feel about and see where you are tender. So for me, I'm more tender, kind of up a little bit higher right now. So I'm just going to kind of get the pressure right onto that. Again, you can kind of feel where that physical barrier is. So if I give pressure, right about there is where I would have to force to be able to press in more. I don't want to force. This is not about forcing. This is about letting go and releasing. So kind of find where that is. This feels a bit much to hold on the end, so I'm actually just going to hold it a little bit closer to me, and that feels a little less disruptive to my tissue. So then what you're going to do is you're going to slowly just kind of let yourself fold forward and bend and soften. And just allow yourself to find the most comfortable position for holding on to that. Now, if I'm here, I can kind of rest my arms down. I don't know what the best way is to show you guys. So I'm kind of holding that spoon so it's coming in and maintaining pressure at that barrier. So again, I'm not trying to force that psoas to release. I'm just giving it some pressure so that I can take my awareness there, and so that there's a little bit of impact input into that fascial system so that it has the opportunity to release any restrictions. This is all about giving opportunity. So again, come into the position, hold for 3 to 5 minutes. You can hold longer if you can stay aware and focused on what's going on and you're feeling shifts and changes happening. I really like this seated release. I think it's great. You can have a ton of control over how much pressure you're giving in. And if you don't have any of the balls that I'm talking about, this, you know, anybody, you can find anything, right? Some kind of spoon, some kind of a rolling pin. You know, there's a lot of really good options. So feel free to put a comment in the comment section if you come up with something super creative. I always find that other people come up with stuff that I've never thought of before, and it's really great because then I can pass it along. So then the next option of having a little bit more control is taking a ball, and you're actually going to be lying on your back and you're giving some pressure down into the abdomen. So you can do this with a 4-inch Sport Time all ball. I find that it is not very much pressure, and so for a lot of people this isn't quite enough. But if you're super tender in this area, this might be just enough. And then a step up from that for a little bit more pressure would be to use something a little bit harder like a tennis ball. So again, you're finding that position off of midline, kind of halfway between the edge of your waist and your belly button, anywhere between the lower ribs down into that groin crease. And so you can take the ball and you can roll around a little bit and figure out exactly where that pressure wants to be. So for me on this left side, really wants to be kind of at the waistline. That's where I feel tenderness. When I give pressure in, I feel a little bit of almost nausea, which is, it's okay. You know, you're pressing into digestive organs, so it's not uncommon for you to kind of feel some of that sensations of nausea, or maybe feeling like you need to have a bowel movement. And then you're just using the pressure of your hands. So you can see I'm not really pressing down. I'm not trying to get a lot of force. I'm just kind of relaxing my arms onto the ball so that the ball is kind of holding my arms up, if that makes sense. And then again, you're just hanging out, letting your breath come as it wants to, releasing and relaxing. If you're really trying to take deep breaths here, you're going to actually push the ball out. So you want to just really let your breath do and be whatever it is without trying to control it. And just letting everything soften. Good, so that's a nice way to kind of get some real controlled pressure into the psoas. If either of those feel like you're not quite getting enough, then what you can do is take a nice soft ball. This is a 4-inch Sport Time all ball. This is what I tend to use, but any kind of soft ball about that shape, obviously shape, about that size, should do the trick. So you're just going to basically lie over the ball. So kind of get yourself down here, and then you can kind of roll off. Again, you can kind of roll around and figure out exactly where you want that ball to be, and then you're just kind of letting yourself soften down onto this. When I first started doing this, I found that I needed to kind of prop myself up because it was so tender. Knowing now what I know, I probably would suggest to my former self, like, hey, maybe you should do this in sitting with something else. But now I find that I'm really able to just kind of relax onto it. Again, you want your head nice and supported. The rest of your body as relaxed as possible. So I actually just ate lunch, so I'm going to get the ball out from under there. This feels like a bit much right now as my body's wanting to digest. But those are the 3 options for the psoas release. So what I would suggest is getting yourself set up with a timer. You can do that on your phone, but set it to like a nice gentle ringtone so that you're not going, softening, relaxing, releasing, and then all of a sudden you get like a bam, bam, something just a little bit gentler. The other option that I think is really great is using an app that's called Insight Timer. And you can set that app to ring a chime at different intervals. So it can be really nice if you want to do a few different positions, either a few different kind of techniques or a few different areas on the psoas. So you can start kind of up at the top and do maybe 4 minutes or so there, and then when it rings, maybe go onto the other side to the top, and then work your way down. So maybe kind of right at the waistline, in the middle of the abdomen, and then down a little bit lower, almost into the pelvis. So kind of 3 distinct areas that you can work on along in the psoas. But like I said, anywhere is fair game. So 3 to 5 minutes is what you're shooting for, as long as you can kind of stay focused and allow yourself to soften and release. You can go longer than that if stuff is continuing to happen. Definitely feel free. I've stayed in releases for 20 minutes at a time because it felt good and things were happening. So shoot me a message, leave me a comment if you have any questions. When you're doing this, like I said, you may feel a lot of pressure into the abdomen. It may feel similar to feeling of nausea or feeling like you might have to have a bowel movement. You actually also may feel this in through the back as well because, as I said, it's attached into those vertebrae. So don't be surprised if you feel that into the back. That can be a really helpful thing for you. This is a really great release for people that have low back pain. So hope you're staying well. Hope that this has been helpful for you and you find something in here that works for you. Take care.